Hi, I'm Gil Kaplan. I'm a gastroenterologist and epidemiologist at the University of Calgary.
I'm Stephanie Coward. I'm a PhD candidate at the University of Calgary.
And today we're going to be talking about a paper published in Gastroenterology titled The Past and Future Burden of Inflammatory Bowel Disease, based on modeling of population-based data. So, Crohn's disease and ulcerative colitis are modern diseases of modern time. Ulcerative colitis was only recognized in the 1800s and Crohn's disease in the 1930s. And we saw in the latter half of the 20th century an explosion in the incidence of IBD. We saw this particularly in the Western world, in North America, in Europe, and in Australia. Now, interestingly, we did notice some paradigm shifts in the epidemiology of the disease at the turn of the 21st century, with many countries in the Western world reporting that the incidence is stabilizing and even in some regions decreasing. But the prevalence, the number of people living with the disease, is accumulating. And we call that accumulation in prevalence compounding prevalence. And it's a function of the fact that IBD is diagnosed in young individuals. There's no cure for the disease, and the mortality, the likelihood of dying from the disease, is quite low. So every day we see a rise in the number of people being diagnosed, and that increases the number of patients that we see in our clinics. So Stephanie, who's a PhD candidate at the University of Calgary, is really interested to try to explore how prevalence has evolved in Canada. She collaborated with the Canadian Gastrointestinal Epidemiology Consortium to look at historical trends of prevalence and to see if she could forecast the future prevalence of IBD.
So what we ended up doing was I worked alongside the Canadian Gastrointestinal Epidemiology Consortium, which is this national group of epidemiology gastroenterologists, and worked together to get 7 provinces worth of IBD prevalence data. We got them from BC, Alberta, Saskatchewan, Manitoba, Ontario, Quebec, and Nova Scotia. This covers 95% of the Canadian population, which is something that we've never seen before, especially in IBD research. We took all historical data and forecasted into the future, not just province-specific, but as Canada as a whole. In Canada, the only overlapping years we had were 2002 2008. So we used those years. We also stratified by IBD, CD, UC, age stratification, pediatrics, adult and elderly, and also sex-specific, so female and male, and forecasted what we had seen historically. What this led to was some pretty significant increases in the overall prevalence of disease. In 2008, we had approximately 167,000 people with disease, or about 0.5% of the Canadian population. In 2018, that increased to about 267,000, or 0.725% of the population. And finally, when I forecasted this into 2030, this number grew astronomically to nearly 403,000 people across Canada being diagnosed with IBD. This equates to about 1% of the Canadian population. Importantly, especially when we age stratified this group, we saw a significant increase amongst all the age groups and the elderly, with nearly double the prevalence from 2008 to 2030. This is so important because this age group, as they age, have more comorbidities and a higher burden of disease on the healthcare system. So that in itself is exceedingly important to estimate as well. The take-home message we found was that by 2030, nearly 1% of the Canadian population will be diagnosed with IBD based on our historical data. And we're really at a time right now where these forecasting models can be used to help drive policy and figure out what we can do now to ensure that these patients receive the necessary care in the future.
Yeah, Stephanie, I find your data fascinating. As a gastroenterologist that cares for patients with IBD on a daily basis, to think that today in 2018 the prevalence is 0.7% of the population and is expected to rise to nearly 1% by 2030, that's a huge impact for our healthcare system. Today we struggle to care for our IBD patients. For example, many patients who live in rural or underserviced areas, they lack access to gastroenterologists, and we know that impacts their care as well as their outcomes. So imagine how much more challenging it will be to give care to those patients as we have more and more patients. And your data didn't just show that the number of people was increasing is going to be a profound effect on our healthcare system, but we're also seeing an older population, an aging population, who's going to have longer disease duration with their Crohn's disease and ulcerative colitis, but also they're going to be having comorbidities of advancing age. And that's going to make a clinic like mine that much more difficult to care for. And so, like you said, I think the big things we're going to have to think about is how do we innovate the care that we deliver to patients with IBD as we go forward over the next decade.